Hi, I'm Dr. Obermeyer, and the purpose of this video is to discuss adhesive capsulitis, also known as frozen shoulder. If you've been experiencing symptoms of pain and difficulty with use of the arm, with activities such as getting the arm overhead or trying to get your hand to the back of your body, you may be experiencing symptoms of adhesive capsulitis or frozen shoulder. The term capsulitis refers to an inflammatory or a healing type reaction affecting the thick, leathery sheath enveloping the ball and socket of the shoulder known as the capsule. In cases of adhesive capsulitis, this capsule becomes inflamed and irritated, and symptoms such as pain and loss of motion can result. The characteristic pain and motion loss present in adhesive capsulitis may accompany a variety of risk factors, which may include diabetes, thyroid disorders, problems in the cervical spine or neck area, as well as having prior surgery. The diagnosis of adhesive capsulitis is evident on the examination of the shoulder, which demonstrates a characteristic loss of motion. Typically, with a frozen shoulder, x-rays are normal, which helps to exclude other conditions that may cause similar symptoms, including things like calcific tendonitis, as well as osteoarthritis and arthritis of the shoulder joint. While an MRI scan is sometimes useful to confirm other disease processes affecting the shoulder, such as rotator cuff problems, it is often not necessary. The treatment for a frozen shoulder is oftentimes non-surgical, where a structured rehabilitative exercise program is initiated that allows the shoulder to stretch so that the terminal limits of motion can be increased. Generally speaking, as the shoulder is stretched out over a period of weeks, the pain and the symptoms of the frozen shoulder gradually will start to improve as the motion of the shoulder improves along with the progression of the rehabilitative exercise regimen. A rehabilitative exercise regimen focusing on stretching of a painful and function-limited shoulder is sometimes challenging, and therefore things like anti-inflammatory medications, a combination of heat and ice, as well as sometimes judicious use of injection therapies can help to improve the tolerance of terminal stretches and rehabilitative exercise as the condition improves. Sometimes a structured rehabilitative exercise program is unsatisfactory and function and motion loss as well as pain persists in the shoulder joint. In these cases, a minimally invasive arthroscopic procedure called a release can be performed, which allows the shoulder to be immediately released so that the shoulder motion can be normalized immediately on completion of the procedure. While an arthroscopic release can be an immediately effective procedure to normalize the range of motion of the shoulder, the recovery is sometimes dependent in part on the patient as well as direction from a physical therapist to maintain the motion that's achieved at the time of the arthroscopic procedure. Other comorbid conditions, including high blood sugar, should be carefully managed during the recovery process to ensure that all efforts facilitate the normalization of shoulder motion through the several weeks following the procedure. Arthroscopic release is performed minimally invasively as an outpatient, where the individual leaves the facility the same day with pain management as well as a plan for vigorous stretches under the direction of a therapist for the days and weeks following the procedure. Usually a sling is maintained only for comfort purposes and is discontinued as soon as possible, permitting full range of motion and use of the arm, oftentimes within just a few weeks. Please visit our website for more information, and thank you for your interest in frozen shoulder, also known as adhesive capsulitis.